We have a serious patient quality safety problem. Medical errors account for significant loss of life and harm to Americans at unacceptable levels.
The crisis we have in patient safety is our great shame.
We have a worker safety well-being problem.
As healthcare organizations, the crisis we have in workplace safety as organizations dedicated to health is also a shame.
Healthcare settings, as we know, are some of the absolute most dangerous, exhausting, and stressful places to work. 14 industries with the highest numbers of occupational injuries and illnesses, 3 are in healthcare, and guess who's at the top of the list? We are. Healthcare workers have more injuries than construction workers. Environmental impacts from the delivery of healthcare include exposure to toxic chemicals for workers, patients, and the communities in which we operate. A 2006 study of umbilical cord blood showed that babies are born with as many as 200 chemicals. We have come together today to launch a collaborative initiative to change what we build, what we buy, and how we operate in order to create safer and healthier places of healing and to lead the economy towards a broader vision of health.
On October 17, 2007, leading hospitals, healthcare organizations, governmental, and NGOs gathered in Oakland, California. Their mission was to define strategies to improve healthcare operations in the areas of worker and patient safety and environmental safety and sustainability. The Global Health and Safety Initiative, or GHSI, believes there is a powerful synergy among these 3 safeties. By improving conditions in worker and patient safety, you can also reduce the environmental impact of healthcare organizations on the communities they serve.
If we each go down various pathways and figure out optimal ways of doing things that are environmentally safe and that are functionally safe and ergonomically safe, if we put all of those parts together, if we learn all of that and then we teach each other, if we get together and share and if we collaborate, we can spread the word and we can create a leverage that extends far beyond any of our organizations.
I think this is one of the most exciting opportunities that we could possibly have because we're doing so many good things through the Institute for Healthcare Improvement and many other great organizations to improve quality processes. But until the launch of this Global Health and Safety Initiative, we haven't focused enough on what we build, what we buy, and the way we manage our organizations from an environmental standpoint. There's a lot out there that this initiative can dramatically accelerate from only some hospitals knowing about it to everybody knowing about it.
The phrase, "first, do no harm," has long been a tenet of the healthcare community. Yet, medical errors remain a serious impediment to the delivery of quality healthcare and overall patient safety standards. Since there's been much work and improvement in the clinical aspects of this problem, attention is now being focused on the built environment. That is, how buildings, floors, and department designs contribute overall to patient safety.
We have gone 100% private room within Kaiser for all of our building programs, and that reduces infection rate, reduces slips, trips, and falls, and improves patient satisfaction. Evidence-based design is how you connect design recommendations related to your facilities to the actual outcomes. So we just moved from an old hospital to a new hospital and saw that our patient satisfaction went up by 24% between the old hospital and the new hospital. That's evidence that our design is working.
Few workplaces are as complex as a hospital. Healthcare workers have a high percentage of workers' compensation claims for physical pains and strains, as well as a high risk of exposure to infectious and parasitic diseases. GHSI will promote new ideas and best practices that are designed to produce safer and healthier workplace environments.
We have 176 safety recommendations that are built into our designs that we do every day. Things like the way the doors swing in our bathrooms, the fact that they have levered handles so you can hit them with your elbow. We've put all of those recommendations in. We now use a resilient or rubber flooring. It also reduces patient and worker slips, trips, and falls, reduces the fatigue to our nurses and others, reduces things like plantar fasciitis, the things you have on your feet when you walk on hard surfaces. So those are the kinds of benefits that we try to employ every day in the work we do.
If you have a safe workplace, you have people that are working comfortably, they're going to provide better service to the patient.
Healthcare is one of the nation's largest industries. It represents more than 15% of GNP and is growing faster than most sectors. Industry-wide, healthcare is one of the top consumers of energy and water and a major user of hazardous and toxic chemicals. As awareness grows about the ill health effects of the numerous products in the industry, design and physical changes are being put into place.
We also have gone to a resilient flooring, replacing vinyl, which reduces the dioxin, which is created in the creation of vinyl and the destruction of vinyl at the end.
We're actually reducing patient exposure. We're actually getting some of these toxic plastics like PVC, vinyl plastics out of the environment, because when you use them and then when you dispose of them, you're creating dioxin, which is building up in our bodies. So here you have an opportunity to reduce patient exposure to a reproductive toxin and protect the environment.
The biggest impact we've had recently in the hospital environment has been that of our Healthy Picks program, where we've been altering the food substances that we bring into the organization, procuring organic pesticide-free products, not only in the cafeterias, but in the vending machine.
GHSI is gaining momentum. We have formed an advisory panel to plan our initial work together. Healthcare Without Harm will be the coordinating entity for the startup period. 5 initial committees will be formed. A committee on corporate social responsibility and public policy. A built environment committee to explore evidence-based design. The procurement committee will pursue safe and sustainable purchasing guidelines. And the operations committee will look at strategies to maximize safety and sustainability. Within the first year, we will have an open source website, a procurement strategy, a research collaborative, complete an eco footprint for healthcare, and establish mechanisms to get the work done. There is a powerful synergy in the 3 areas of patient safety, healthcare worker safety, and environmental safety and sustainability. If we carefully focus our energies at this health and safety nexus, GHSI believes significant progress can be made for all of our communities and for our planet.
We're creating healing environments that support life for people and on the planet.
I believe we're going to look back on the launch of this Global Health and Safety Initiative and say, October 17th, 2007 was a benchmark day. This was a day when we really got leaders together and started on a journey that is a real action agenda that can make a difference in people's lives and in the environment in which we live.
We all need to remember that if we do this right, green is a team sport.
So let's roll up our sleeves and get started.